Hey everyone, it's Benjamin. Today we're tackling one of the trickiest NClex topics, leadership and management. I've got 20 NClex style questions lined up to get you thinking like a charge nurse. Grab a pen and paper, treat this like a real practice test, and keep score as we go. Practice is key. Let's build your confidence so you can walk into the NClex ready to crush it. If you find this helpful, hit that like button and share with your classmates. Ready? Let's get started. First question, which task can an RN safely delegate to a UAP? Options A, administering oral meds to a stable patient, B, assessing pain, C, developing a care plan, D, performing a sterile dressing change. Remember, UAPs cannot administer medications or perform assessments or sterile procedures. The correct answer should be none, but if you see similar questions, focus on tasks like assisting with daily living. Always ask, does this require nursing judgment? If yes, don't delegate to a UAP. Know the 5 rights of delegation. Right task, circumstance, person, direction, and supervision. The NClex wants to see you understand safe, legal delegation. Next up, prioritization. For patients, A, routine dressing change. B, respiratory rate 28, short of breath. C, post-op pain 6/10. D, needs help to bathroom. Who do you see first? It's B, shortness of breath and high respiratory rate signal possible respiratory distress. ABCs, airway, breathing, circulation, always come first. The others are stable or non-life-threatening. NClex wants you to spot the most unstable patient. Think, who is at greatest risk for a bad outcome? Prioritize using ABCs and stability. Leadership scenario. 2 nurses are arguing about assignments. What's the manager's best initial action? Options. A, ignore. B, tell them to stop. C, facilitate a private discussion. D, report to HR. The answer is C, facilitate a private discussion. Address conflict privately to de-escalate and find a solution. Ignoring or jumping to HR doesn't solve the root issue. Good leaders mediate and empower staff to resolve conflicts. Delegation time. Which task can an RN delegate to an LPN? A, initial assessment. B, develop care plan. C, IV push meds. D, measure BP for new admission. The answer is D. Measuring BP is within LPN scope. Initial assessments and care plans are RN responsibilities. IV push meds are usually RN only due to risk. LPNs can collect data and perform routine tasks, but RNs synthesize and plan care. Know your team's scope. When delegating, what's most important? Options. A, time of day. B, personal relationship. C, ensure competence. D, whether you've done it before. The answer is C, ensure the delegatee is competent. You're accountable for the outcome, so verify skills and training. Never delegate based on convenience or relationships. Always check facility policy and individual competence. Patient safety depends on the right person doing the right task. Performance issue, a nurse is consistently late. What's the best initial action? Options A, memo to all staff. B, private discussion and improvement plan. C, terminate. D, assign bad shifts. The answer is B, discuss privately and create a performance improvement plan. Address issues directly and supportively, not publicly or punitively. Listen for underlying causes and set clear expectations. Document the plan and give the nurse a chance to improve. A competent adult refuses a prescribed medication. What's your primary responsibility? Options. A, give it anyway. B, document refusal and notify provider. C, persuade. D, ask family to convince. The answer is B, document and notify the provider. Respect patient autonomy and communicate refusals. Educate, but never coerce or force care. Documentation protects everyone. SATA time. Which actions show effective nurse management? A, assign by competency. B, ignore conflict. C, encourage open communication. D, give constructive feedback. E, make all decisions alone. Correct? A, C, D. Assigning by competency ensures safe care. Open communication builds trust and teamwork. Constructive feedback helps staff grow. Ignoring conflict or being autocratic harms morale. Effective leaders involve and support their team. Telephone order scenario. What's the safest action? A. Give med immediately. B. Have a second nurse listen. C. Write down and read back. D. Tell MD to enter it. The answer is C. Write down and read back the order. This prevents errors and confirms accuracy. Never skip the read back step. Having a second nurse is helpful, but not a substitute. Patient safety comes first. Family member upset at nurse's station. Best initial response? A. Tell them to quiet down. B. Listen and offer to escalate. C. Call security. D. Ignore. The answer is B. Listen actively and offer to involve the nurse manager. Validate concerns and show you care. Escalate appropriately if needed. Avoid confrontation or ignoring the issue. De-escalation and communication are key. You're at the med cart. Call light goes off for a fall risk patient needing the bathroom. What do? Options. A. Finish meds. B. Ask patient to wait. C. Help patient. D. Delegate without checking. The answer is C. Help the patient immediately. Safety trumps task completion. Don't risk a fall by delaying. Delegation is fine, but only if you know the UAP is available. Always act on the most immediate safety threat. Manager wants to implement bedside shift reports. First step, A. Announce policy. B. Collect data. C. Make plan. D. Discipline non-compliance. The answer is B. Collect data on current practices and staff opinions. Assess before you plan or implement change. Involving staff early increases buy-in. Announcing without groundwork leads to resistance. Assessment, then planning, then action. Suspect a colleague is diverting narcotics. What do? A. Confront. B. Report to supervisor. C. Ignore. D. Post on social media. The answer is B. Report discreetly to your supervisor. Patient safety is your top priority. Don't confront or ignore. Don't post online. Report objective observations, not rumors. Let management investigate. New nurse makes a med error. No harm done. What's the charge nurse's best action? A. Report to board. B. Discuss privately and assess impact. C. Announce in huddle. D. Fill out report only. The answer is B. Discuss privately and assess the patient. Focus on learning, not punishment. Use errors as teaching moments. Public shaming or skipping the conversation is harmful. Just culture means supporting growth and safety. Which is a breach of care? A. Delegate bath to UAP. B. Give med without checking ID. C. Document vitals. D. Ask about allergies. The answer is B. Administering meds without checking ID is a major safety violation. Always use 2 identifiers. The other actions are correct and safe. NClex wants you to spot unsafe shortcuts. Patient identification is non-negotiable. You see a med order with a high dose. What do? A. Give as written. B. Give lower dose. C. Clarify with physician. D. Ask pharmacist. The answer is C. Clarify with the physician. Never assume the order is correct if it seems off. You're the last line of defense for patient safety. Pharmacists are helpful, but you must resolve with the prescriber. Always clarify questionable orders. Staffing question. What's the main principle for assignments? A. Friends. B. Rotate tough cases. C. Match skills to acuity. D. By room location. The answer is C. Match staff skills to patient acuity. Safety and competency come first. Assignments should reflect experience and patient needs. Fairness and efficiency matter, but not at the expense of safety. Charge nurses must see the big picture. SATA. How can a manager improve teamwork? A. Open communication at handoff. B. Punish disagreement. C. Mediate conflicts. D. Team building activities. E. Discourage socializing. Correct A, C, D. Open communication and mediation build trust. Team building boosts morale and collaboration. Punishing or isolating staff destroys teamwork. Happy teams are productive teams. Leadership is about fostering connection. New grad assigned a complex dressing change they've never done. What should they do? A. Try anyway. B. Ask family. C. Refuse. D. Seek guidance from charge nurse. The answer is D. Ask for help from the charge nurse. It's safe and professional to seek support. Never perform unfamiliar procedures alone. Use resources to learn and grow. Patient safety always comes first. Staff morale is down, sick calls are up. What's the best first step? A. Stricter policy. B. Attendance bonus. C. Staff satisfaction survey. D. Mandatory fun day. The answer is C. Conduct a staff survey to identify concerns. Assess before acting. Find the root cause. Quick fixes don't solve underlying issues. Listen to staff and address real problems. Effective leaders diagnose before prescribing solutions. That's a wrap. You made it through all 20 questions. Congrats! Let me know your score or which questions challenged you in the comments. If this helped, hit like and share with your study group. Subscribe for more NClex practice and tips. Keep studying, take care of yourself, and remember, you've got this. See you in the next video.